Welcome everyone. My name is Dr. Lindsay White. I'm the owner and chiropractor at Utopia Family Chiropractic. At our office, we see patients of all ages, but our focus is on family, pregnancy, and pediatric care. We welcome all patients to our office to hear your story and help you live life to the fullest with full nervous system expression. There are so many health issues from kiddos to pregnancy that so many people think we just have to live with, and we want you to know that that's not the way it has to be. We believe you all deserve to have full health, and this aligns with exactly what we are talking about today. Our focus is your nervous system and optimal function. Our nervous system controls everything, and that includes our hormones. However, it's not just about getting adjusted. I get adjusted weekly, and I quickly found out that I was experiencing hormone imbalance. I can also tell you that I've spent my fair share of time and energy studying, and I thought these symptoms were just something I'd have to live with. That being said, we have a very special guest with us today. She graduated from Drake University with a doctorate in pharmacy and has been working with hormones for over 6 years, and most recently became a certified theta healer. She has spent 20 years helping people with their health, which has involved with combination of her traditional path through pharmacy school, her own health, and continued learning. She has a passion for helping people understand that their health is important, and listening to the body and the symptoms help her help us all the best way she knows how. She has gone and found an even deeper passion for helping our bodies heal naturally with what we're putting into our bodies every day. What's amazing is not only does she talk the talk, but she walks the walk. She's been using this protocol for over 6 years and helped countless women experiencing improved mood, regular cycles, decreased stress, weight management, and more. Personally, I've experienced benefits of more energy, decreased acne, and significantly less tender breasts. Based on what we're surrounded with in our environment, we're inundated with all things that disrupt our hormones. So we're about to learn the ins and outs of hormones, what they do, how they get imbalanced, and what it means to become imbalanced, and finally action steps to balance our hormones naturally. So please help me welcome Dr. Lisa. Dr. Lisa, thank you so much for being here today.
Thank you, Dr. Lindsay. I appreciate you. Well, let me share my screen and we will get started. All right, here we go. We are going to talk today about balancing your hormones, an introduction to seed cycling. Thank you so much, Dr. Lindsay, for hosting today's webinar. So as Dr. Lindsay mentioned, today we're going to talk about hormone imbalance. What is it, what causes it, and how can we fix it naturally? First, let me take a step back though and share with you my story, because I'm sure many of you are probably thinking, well, she is a pharmacist that does things naturally. What in the world? Well, I have been helping people with their health for nearly 20 years, as Dr. Lindsay mentioned, graduating from Drake University with my doctorate in pharmacy, and then moving on to focusing on natural hormone balance, some holistic nutrition, and also theta healing, which is an emotional support technique for trauma, fear, and limiting beliefs. I started out on the traditional path and then made a pretty significant change. When I was starting out on that traditional path, I pretty much bought into the philosophy that I have a problem, there's a medication for that. And so my problem was that I had horrible PMS symptoms and very bad cystic acne, which was definitely related to my cycle. As it turns out, I was learning, when I started experiencing these things, we were learning about birth control pills in pharmacy school, and in particular learning about the ones that helped with cystic acne. And I thought, well, this is the answer to my question and to my problem, right? So I'm going to try it. That was the start of 15 years of using the birth control pill to control my symptoms. And during that time, I developed cellulite, and I was unable to lose the last 5 to 7 pounds that I was hoping to lose, except during that week that I was off the pill and taking the placebo. So I finally figured out that I was having significant hormone imbalance as a result of being on the birth control pill, lots and lots of estrogen, and I wanted to make a significant change. So I found ways to address my health issues through holistic nutrition, supplements, lifestyle changes, and emotional support techniques. And one of those techniques was seed cycling. So as Dr. Lindsay mentioned, I have been doing this for over 6 years. and I have no PMS now, minimal to no acne. I lost the weight and the cellulite went away, and I have very, very regular periods. It is a blessing in disguise for sure. So which of these best describes you? Go ahead and enter your comment in the comment section. Do you want to manage symptoms of PMS? Are you looking to get pregnant? Are you postpartum, nursing or not nursing, pre or perimenopausal or postmenopausal? And so Dr. Lindsay, which of these categories would you say your patients fall into the most?
Yeah, so we obviously have a range of patients here at the office, but the biggest I would say here for sure are going to be our postpartum nursing or moms who are now done with their nursing experience for our patients, and then also ones wanting to get pregnant, and then forecasting too with a lot of kiddos we see, looking at when those kiddos get older is something that we're not necessarily dealing with right now, but knowing as I grew up through just my life too, knowing that some of these kiddos, when they do grow up, are going to have some of those PMS symptoms that we want to help with them. But the majority that we're seeing here are adult women, but mostly the postpartum nursing, getting pregnant, or then now we're no longer nursing or we've chosen not to nurse.
Perfect. Okay. Well, and I work with women all across the spectrum. So no matter which bucket it is that you fit into, we definitely can see if seed cycling is a good fit for you. So my passion is helping women get the health and healing that they deserve naturally. I believe that too many of us are suffering from hormone imbalance and we want to feel like ourselves again. And so I want to let you know that you don't have to live this way. There are alternatives to hormone medications for managing your symptoms, and you deserve better. So let's dig right in and start talking about what do hormones do? Well, hormones are messengers, basically, that control and coordinate lots of activities within the body, probably many more so than you even realized. Things like our energy level, our mood, when we go to sleep and when we wake up, our blood sugar levels, blood pressure, memory, if we have inflammation going on behind the scenes, what our weight is, if we're growing and repairing and healing, and even things like knowing when we need to get out of a dangerous situation for survival. And then, of course, the hormones that affect puberty, pregnancy and breastfeeding, perimenopause, and menopause. Those are the ones we're going to be focusing on today, and they are estrogen, progesterone, and testosterone, mainly. So what is hormone imbalance? Well, if we take a look at the pictures at the bottom of the slide, the teeter-totters, our hormones should look like the middle teeter-totter. So envision two kids of about the same size and weight who are on either end of the teeter-totter, just very nicely getting along and playing, and you have this nice ebb and flow with each side. Then imagine kids who are very different in size and weight, and one of them is a little heavier, and so we have more of the left or the right situation with the teeter-totter, and we're out of balance. That's when we experience symptoms. So symptoms are our body's way of telling us that something is not right. So I want to assure you that if you believe that you are having symptoms and you're not quite feeling right, it is not in your head, sweet friend, and you are not crazy. It is highly likely that it is your hormones out of balance. So what causes hormone imbalance? Well, to start off with, simply age. Between the ages of 35 and 50 years, estrogen drops by about 35%, but progesterone drops by more than double that. And so we automatically go into this state of hormone imbalance because we have estrogen that's up here and progesterone that is down here. And the space in between means we're out of balance and we have symptoms. Poor nutrition is another reason for hormone imbalance. If we're not providing the right nutrients for our body to use as fuel, we cannot make the hormones we need to make in the amounts we need to make them. Next up is poor sleep. Our body does major repair work and detoxification and healing while we're asleep. So not sleeping long enough or getting poor quality sleep can disrupt our hormones. Next is toxins. Many toxins look and act like hormones, so it's hard to regain and maintain balance when our toxic load is high. For example, there are a number of things that we call hormone disruptors, which are xenoestrogens or fake estrogens, meaning that when we breathe them in or we put them on our skin, they get into our body and they affect our estrogen level, increasing it. We can find these types of chemicals in air fresheners, cleaning products, personal care products, plastics, and more. So think about the things that you're using to see if this is potentially something that is adding to your hormone imbalance. And lastly, stress. Stress is an inevitable part of life these days, especially for women. We wear so many hats, right? We are the errand runner, the housekeeper, the school lunch maker, we're chauffeuring kids around. If we work outside the home, there's additional things going on there. So it's completely understandable why women are stressed out and exhausted when we're taking care of everybody else except ourselves. And managing stress well is critical to balancing hormones. So which area would you like help in? Go ahead and type your responses in the comments. And then Dr. Lindsay, what would you say would be kind of top on your list or top on your patients list that you see?
So for me, the biggest thing when we first met was definitely always needed help manage stress, me personally, and always getting good sleep too. At the time, I was only probably getting like on average about 5 hours of sleep, 5 to 6, which isn't good. And even the quality of sleep, not the greatest. So definitely managing stress and sleep for me. And then patient wise, a lot of it is what we're seeing areas or what I'm seeing with my patients is a lot of it comes symptomatically wise is what we're seeing is where we're noticing certain symptoms of potentially mood or that we know it's exactly related or directly related to their cycle, whether it's headaches hitting at certain times of the months where we're having the switch in the hormones, and then also the other symptoms that are related to it when we're looking at weight loss that's not happening that you mentioned, as well as headaches. Like I said, headaches is a big one. For me too, it was definitely acne, as I am 31 years old and I was having way too much acne, again, for me personally. So for patients, again, we're looking at those different symptoms that we're seeing and looking at how we can not just, like you said with your journey, go after the effects or what we're seeing, but really look at the cause. And then the other thing is really that I noticed the first trigger for me with my patients is when I have patients that talk about their emotions just being all over the place, where they're having these huge swings. And that's a little light bulb that goes off in my head that says something's going on, especially with hormones, especially when we're looking at our mommies that just gave birth or just getting off nursing or trying to figure all of it out. There's something deeper going on of having these huge emotional swings and looking at how hormones are related.
Oh, yes. Great answer. Okay. So how do we balance hormones naturally? Well, I have been using a protocol called seed cycling and found it to be incredibly effective. Seed cycling is a nourishing and gentle way of balancing estrogen, progesterone, and testosterone. And yes, women need testosterone in less amounts than men, but we still need it. It's super important. It plays a huge role in our thyroid, but also in helping us to build muscle mass and burn calories and all of those kinds of things. So these are the hormones that we see play a role in PMS, in pregnancy, postpartum for sure, and perimenopause and menopause. Seed cycling uses something called phytonutrients, which are plant-based nutrients, and we use them to help support balanced hormone levels. They support the body's natural rhythm by giving it what it needs when it needs it. And we use things like flax seeds, pumpkin seeds, sesame seeds, and sunflower seeds to do this. That's where the term seed cycling comes from. So what can it help with? Well, a whole slew of things really. Acne, cellulite, because cellulite really is simply the way that the body is building up too much hormones that it cannot detox. Similar with acne, that is our body's way of saying that our liver is having a really hard time processing out extra hormones, and so it comes out in our skin. Endometriosis, fatigue, fibrocystic breasts, fibroids, heavy bleeding, hot flashes and night sweats, which we commonly see during perimenopause and menopause, often indicative of estrogen levels that are too low. Irregular periods, that might be, it's not 28 to 30 days between day one of one period and day one of the next period would be considered an irregular period. Mood swings, painful or tender breasts, PCOS or polycystic ovarian syndrome, PMS, and weight gain, particularly particularly around the hips and thighs. Those are all things that seed cycling has been shown to help with. Now, which stage of life can it also help with? Well, pretty much the whole gamut. So as women, we have the chance of being in hormone imbalance for most of our lives, really, particularly most of our adult lives. So with puberty, seed cycling can help calm those extreme hormone swings that we all remember going through as teenagers, or you may have teenagers now that you're experiencing that with. It can help with infertility or pregnancy planning, because once we get back in balance, conceiving may be easier because we prepare for this every month. That's the whole reason why we have a period and we have a cycle, is for pregnancy. Breastfeeding, it can be used with and help with. Balanced hormones in mom means balanced hormones in baby, which is magnificent. Plus, we get critical nutrients from seed cycling for both mom and baby. It can also be used postpartum to help, again, calm those extreme hormone swings. Once baby is delivered, those hormones that have been helping us during pregnancy really take a nosedive. And so that's why we feel so out of sorts after delivering. And so we can help to calm that down with seed cycling. And then also perimenopause and menopause. As we ease the transition into making fewer and fewer amounts of hormones like we're supposed to, we can help really make that a much more gentle ride with seed cycling. So what we see here is a graph of what our female hormones are supposed to look like during a normal 28-day cycle. So day 1 to the far left would be the first day of your period, and then through day 28. And what we're seeing here is that in the first half of the graph on the left, you see that the pink line of estrogen is higher. The yellow line of testosterone pretty much stays consistently on the lower side, and then the green line for progesterone starts off low and then gets higher. And then on the second side of the graph, the right side, after we go through ovulation around day 14 or 15, we start to see estrogen go down, that pink line, and the green line of progesterone start to go up. So in the first half of our cycle, we need more estrogen. And in the second half of our cycle, we need more progesterone. So that's kind of what I was talking about with that nice balance of the teeter-totter. We need estrogen to go up, and then progesterone to go up, and estrogen to go up, and progesterone to go up. And then kind of sitting down there at the bottom, we have testosterone that just kind of is mostly low throughout the entire cycle. So for phase 1, or that first part of your cycle, what happens with seed cycling is we provide nutrients in the forms of omega-3 fatty acids, zinc, B vitamins, selenium, and ALA, or alpha-linolenic acid. And we do that through plant-based sources. So we give you, of those different seeds that I mentioned, they help to provide levels of estrogen, progesterone, and testosterone by giving the body these wonderful nutrients. The other thing that happens during phase 1 is we help to block and remove excess estrogen. So while we do need estrogen levels to go higher in the first phase, we don't want them to go too high. So the wonderful thing about seed cycling is that we give the body nutrients to use, and the body decides how much do I need, and then I can get rid of the rest. And so the seeds have something, a part of them called lignans, which allows them to block estrogen at their receptor sites and also remove excess estrogen. So we ensure that those estrogen levels are not getting too high. Also, the seeds are a great form of fiber, and fiber is one way that we can detox extra amounts of estrogen. Also during this phase, the nutrients that we provide will help to reduce inflammation, which means that we are helping with PMS. In the second phase, after ovulation, the second half of our cycle, the seeds are giving us omega-6 fatty acids, zinc, selenium, vitamin E, vitamin B6, and magnesium. And so these are plant-based sources of progesterone and testosterone, exactly what we need in that second phase. Again, we're also helping to block and remove excess estrogen, because now that estrogen curve, the pink line, needs to start coming down so that progesterone can be the higher hormone during this phase. So again, we're using those lignans and great sources of fiber to help us do that. And also in this phase, we are reducing inflammation and helping with PMS. One of the other really amazing benefits of estrogen, of seed cycling, is estrogen detoxing. So we can detox estrogen in a number of ways throughout the body, and there are good ways to do that, and there are not so good ways to do that. And so what I want to show you here is how seed cycling can affect how we detox estrogen. So essentially, estrogen can go through the liver to get detoxed, and it can go down one of three pathways. So I'm going to focus on the arrows that are the three arrows that are pointing down. One of them points to 4-hydroxyestrone. The middle one points to 2-hydroxyestrone, and the one to the right points to 16-alpha-hydroxyestrone, near where you see the letter B on the screen. And things like flaxseed, which is in seed cycling, plus omega-3s and B vitamins, which is also part of seed cycling, and exercise and cruciferous veggies, things like cabbage, Brussels sprouts, cauliflower, and broccoli, help to shift that estrogen to detox down the A pathway, or that middle pathway, to hydroxyestrone. We want this to happen as much as possible because this is the cancer protective pathway. Versus things like pesticides, toxins, obesity, and inflammation, which help shift those estrogens down that B pathway, or the 16-alpha-hydroxy pathway, which is actually cancer promoting. So one of the great things about seed cycling, besides just getting our hormones in balance, is that we help to push that estrogen down a really protective pathway. One of the other benefits of seed cycling is the fact that it includes omega-3s and omega-6s, which are essential fatty acids. Essential fatty acids means that the body cannot make them on their own, so we have to give our body these nutrients in order for them to do their job. And omega-3s and omega-6s are critical for brain development in babies and kids. It results in higher intelligence, better communication and social skills, fewer behavioral problems, and fewer instances of ADHD, decreased risk of developmental delays, so the babies and the kiddos are meeting their milestones on time, and also decreased risk of asthma and allergies. These omega fatty acids also help to maintain a healthy nervous system. So if you can imagine the miraculous benefits of pairing seed cycling with chiropractic care, you are really nourishing your nervous system well. Omega fatty acids also help to lower the risk of colon and breast cancer and the risk of dementia. So there are many benefits to seed cycling outside of simply balancing your hormones. So is seed cycling for you? Well, I would say yes, if you are currently having symptoms, are taking the birth control pill or hormone replacement therapy and no longer want to be on them. Also, yes, if you have symptoms and you don't want to start either of those hormone medications to begin with. So yes, if you are wanting to manage things without hormone medications. Seed cycling probably is not for you if you're having symptoms and you're on the pill or hormone replacement therapy and you want to stay on it. Or you have an IUD, whether it's hormonal or non-hormonal, or some sort of hormone implant. The reason for that is the synthetic hormones are going to win out. So because of the amount of hormone that's in them and how we take them every day, it's just not possible for the seed cycling to really help much with that. So it's probably not something for you if you're not willing to get off the hormone medications. And certainly if you have questions about your specific situation, we can talk through that. So as women, keeping our hormones in balance and therefore feeling like the best possible version of ourselves is an uphill battle. Remember, I showed you that we basically can be in hormone imbalance at any point in time in our life. And the older we get, the more common it is for us to be having symptoms and be out of balance. We are just designed to produce lower amounts of hormones as we age, and there's lots of things that are working against us. So that's where I come in. I help women to feel better than they have in a really long time, physically, emotionally, and spiritually, through the use of plants and supplements and even some theta healing, and also through the use of nutrition, stress management, self-care, and looking at how we can decrease the number of toxins that we're coming in contact with. So I want to take a few minutes here as we get toward the end of our presentation to show you some women who have gone through the program with me and how that resulted for them. So this is Sarah, and Sarah is 38 years old. She had used hormonal birth control for 10 years before wanting to get off of it. She would always experience low back pain, very painful pelvic floor pain, super heavy periods. And as she was getting ready to start her period, she would find herself to be very emotional, so lots of mood swings, and she'd have lots of cravings for foods. So she started seed cycling in July of 2019, and within 2 to 3 months, all of her symptoms had resolved. This is Amanda, and Amanda is 30 years old, and as she would come up on the time for her period to start, she would experience significant fatigue. Her energy would plummet and her stress level would skyrocket trying to compensate for that. And she would get super emotional. And her cycles were typically anywhere from 45 to 60 days long. So the time between day one of one period and day one of her next period was not the common 28 to 30. It was almost double that in some cases. So she started seed cycling in August of 2019, and all of her symptoms resolved within about actually 6 weeks. It was very quick for her, and she now is cycling every 28 days just like she's supposed to, and does not even know that her period is coming without looking at the calendar because she feels so good. This is Denise and her sweet pup Ruby in the back there. Denise is 44 years old, and she started having hot flashes at the age of 36. So she was diagnosed with early perimenopause, and her doctor at the time told her she was pretty much just going to have to deal with that, that there really wasn't much they could help her with. She was also experiencing fatigue, weight gain, and very painful, heavy, irregular periods. She's been seed cycling for going on 3 years now at this point, and her symptoms resolved within the first 3 months, and then after about a year, she was down to her ideal weight. So getting the health and healing you deserve is something that I believe all of you deserve, and so I would like to invite you to schedule a consultation with me. You can do that with the online link there at calendly.com/Dr. Lisa Handley. I do in-person and remote or virtual appointments, and we'll spend time hearing your story, answering your questions, and customizing a program for you that includes seed cycling, nutrition, stress management, self-care, and decreasing toxins. And of course, let's connect on Facebook too, where you can find some additional helpful information. You'll find me at Health and Healing with Dr. Lisa. So thank you all so much for your attention today and for interacting with us through this presentation. It's been a pleasure to chat with you about seed cycling.
Thank you so much, Dr. Lisa, and I appreciate you all being here. We do have this recorded for you, so if you missed anything or some of it seemed a little bit overwhelming, I know the first time I had a couple mind-blowing moments again of those things that I thought they were just normal, but they're not normal. So if you have any questions, definitely reach out to myself or Dr. Lisa. I will comment those links to get a hold of her and also tag her Facebook page in a follow-up email to you. So if you guys have any questions, let us know. Thank you so much for your time. Dr. Lisa, thank you. As always, that information is so good, and definitely I appreciate you being willing to get this information out, because I think it's something every woman needs to hear, and like you said, deserves to hear, because our health is important, especially going forward. So thank you so much for your time and going through that. I appreciate it.
Thank you.
Awesome. Have a great rest of your day, everyone.